Right, so today we are going to be learning from chapter 23, which is Therapeutic Agents for the Renal System. This is taken by Mosby's Pharmacy Technician, Principles in Practice, 5th edition. In this chapter, you as the pharmacy technician student will be learning the following objectives. You should be able to describe the major components of the renal and urological systems. You should also be able to list the primary symptoms of conditions that's associated with the dysfunction of both the renal and urological systems. You should also be able to recognize prescription and OTC, better abbreviated as over-the-counter drugs that's used to treat the conditions that's associated with the renal and urological systems as discussed in this chapter. By the end of this chapter, you should also be able to write the generic and brand names for the drugs that's discussed, as well as be able to list the appropriate auxiliary labels when filling prescriptions for the medications that's discussed for the treatment of conditions associated with the systems of the renal and urological system. So now that I've gone over the objectives, we'll first get into some anatomy and physiology of the renal system and urological system. First off, whenever you hear the word renal, you should know that that has to do with kidneys, and kidneys has to do with your input and output of your liquid, um, of the liquid waste in your body. So with your kidneys are located in the inside of your upper abdominal cavity on either side of the vertebrae. And it looks like a bean shape. That's why when you see the actual kidney beans, it actually um, it's that shape. So when you hear, again, we're talking about renal area. So the renal fascia is a fibrous connective tissue that holds the kidney stationary. And so inside of your kidneys, you have arteries. And so the renal artery is where the blood enters the kidneys. Now, when it comes to the kidneys, that is where your blood is filtered. And also, the sodium and chloride is reabsorbed into the body and the circulatory system. So your circulatory system is where the blood flows throughout your body. And inside of your kidneys, you have a renal vein and a ureter that leaves the kidney via the hilus. Now, the renal vein returns to the body, the renal vein returns blood to the body after the filtering process. So you might ask, as I kind of shared with you, representing the kidneys is the input and output. What is the direct function of the kidneys? The kidneys filter the blood and send the waste to the bladder as urine. So that's better known as your liquid waste. When medications are taken, the drugs are excreted through the renal system. So that's why some medications, if it's taken, could harm your kidneys, but there are some medications that can be taken to help protect the kidneys, uh, even though the medications are excreted through the renal system. And for more of a demonstration to see what the renal system looks like, you can refer to figures 23.1 as well as 23.2. So now that we've learned a little bit about the anatomy and physiology of the renal and urological system, let's continue learning more about it. So the ureter carries waste that's removed from blood to bladder, and that's where it's also stored for excretion. Anytime you hear the word excretion, you should know that represents elimination. Something's exiting. So when it comes to the renal system, the bladder is basically a holding tank that can expand. So you may even feel your bladder expand after you kind of drink something and it's digested and you kind of have to go to the bathroom. That's your bladder that's full and it needs to release itself so that it can be empty again. Now, the urine is eliminated through the urethra, which is a tube that leads from the bladder to the outside of the body. And so there may be a question of what are some other organs that can excrete waste through the body. Other organs that can excrete waste through the body would include the intestines, the lungs, and the skin, which also excrete waste products from the body. Now, during urination, the sphincter muscles relax to open the bladder, while the bladder, which you should know is also a muscle, contracts to squeeze the urine out. And so now that we talked a little bit about the systems of the renal and urological, let's next get into what are the functions of the kidney. So the kidneys, remember, it's a input output action that happens. So the kidneys filter out and they also reabsorb nutrients and chemicals. When the kidneys are full, when the bladder is full of liquid waste, it's going to be eliminated by excretion. So that is liquid waste. And you should understand and know that there are four major functions of the body, and that is abbreviated as ADME, ADME, which is also known as pharmacokinetics. So the four major functions of the body are absorption, distribution, metabolism, and excretion. For absorption, that is when something that can be when something enters the uh, enters uh, when something enters your body, and it's basically the intake of liquids, solids, and gases into the body. So what's absorbed, if it's something that's taken, once it's absorbed into the body, then it's distributed uh, and goes throughout the body. So distribution is the way in which chemicals, nutrients, and even drugs move throughout the body to their target organs and tissues. So when a medicine is taken, the medicine is first absorbed. So it's taken either by different routes. In this case, I'm going to use the oral route. Something's taken by mouth, it's absorbed into the body, and then the drug is then um, the chemical of the drug is then distributed to its target organ or tissue. And then the body goes through the metabolism phase, which is where the chemical changes and reactions in the body system. So anytime you hear metabolize, you should think of that's where the body breaks down the drug. And then you have excretion, which is the elimination of chemicals and substances from the body system. And remember, there are two ways how something can be excreted. That's through liquid waste or solid waste. So now that we learned about the four functions of the body, which is absorption, distribution, metabolism, and excretion, that's abbreviation is better known as ADME, ADME. And the four functions are essential to the function and balance of the body, which remember, our bodies also have to maintain homeostasis. So the kidneys must also maintain a balance of water and electrolytes. So we're learning about the functions of the kidneys. Let's continue. So interesting facts about the kidneys. The bladder holds up to 1,000 milliliters of urine. That's about a liter of urine that the bladder can hold. Our body excretes about 960 milliliters each day. Now, urine contains urea, which is produced by the liver, and it's a form of nitrogen that changes to ammonia. So within our kidneys, the kidneys balance the fluid content of the body. And the fluids that's inside of the body could include water, plasma, blood, and ions. So when you hear the word urea, what is urea? Urea is a byproduct of protein metabolism in the liver. So again, we're learning about the functions of the kidneys. As we continue to learn more, we'll understand that the kidneys balance and eliminates the ions within the blood. Acidosis and alkalosis is an imbalance of ions in the blood. So acidosis means it's too many free hydrogen ions, and alkalosis means it's too many hydroxide ions. Now, with BUN, which stands for blood urea nitrogen, the test determines the levels of the acid in the patient's system. And so this could also let the physician, or should I say the prescribers, know, or even the healthcare professionals know what the pH level is in the patient's body. So we remember learning about pH. pH represents if the patient's body could be either more alkaline or acidic. 7.4 is technically considered neutral. Anything that's below 7 is considered acidic. And then anything that's above 7 is considered alkaline. So that's the range of the pH. Now with the kidneys, they filter about 45 gallons of blood products each day. Now people on a high protein or low carbohydrate diet can develop a condition known as ketosis. So in this condition, the body produces ketones as it burns fat instead of producing carbohydrates for fuel. So such a diet is bad for the kidneys for two reasons. There's a high level of protein, high levels of protein actually strain the kidneys, and the ketones themselves can cause kidney stones or even kidney failure. Now, what functions do the kidneys have besides filtering waste? Well, the kidneys can also produce erythropoietin, which is a stimulator of red blood cell formation, and then also renin, which is a blood pressure regulator, and is also the active form of vitamin D. So now that we learned about the function of the kidneys, let's next learn about the nephron function. So with the nephron function, nephrons do all the work of regulation of fluids, solutes, and waste in the kidneys. So each kidney, you should know, contains millions of nephrons. Anytime you hear the word nephron, that also consists of the renal system. So a specialist who specializes in the renal system is called a nephrologist. So as we learned about the nephrons, we'll understand that the nephrons work 24 hours each day. And as I mentioned before, nephrons regulate the fluids, solids, and waste for the body. And so you should understand that the renal system is basically a filtering system. You have an input and an output when it comes to the renal system. So as we continue to learn more about the renal system and the urological system, you'll learn about the tubular reabsorption. And so there are two mechanisms that affect the balance of the ions. So there's an ion exchange and an active transport. And so within the ion exchange, you have the sodium and hydrogen ion exchange, which is also the medical term for osmosis. And the result of the tubular reabsorption could be a decrease in excreted water. And so with the active transport, it's a one-way uptake of sodium and chloride from the loop of Henle. Now, that result can cause sodium that can be returned to the circulatory system. And so the question might raise, what function does sodium perform for the nervous system? Well, sodium helps to conduct nerve impulses, so it's important for it to be reabsorbed into the circulatory system. And for more information and for a more visual aspect of this particular example, you can refer to figure 23.4 as well as 23.5. So continuing learning about the tubular, we first learned about the tubular reabsorption. Next, we'll learn about the tubular secretion. The tubular secretion takes place throughout the nephron. And so you have the first, the ions, the toxins, and the water, which are secreted into collecting duct. And that's where secretion and elimination of weak acids. An example of medicines that might be that way would be aspirin and penicillin. And then you have weak bases. Examples of that would be narcotic analgesics, metformin, and antihistamines. Those take place. Now, the second secretion allows for the kidneys to regulate the pH of the body through the urine acidification. Now, acidification is a process of eliminating extra hydrogen ions through the urine. Now, when it comes to the urine, the pH is about a 4 to 5. And as I talked to you earlier about what the neutral value of pH should be, blood pH is 7.4. So when it comes to certain things that's produced when it comes to the tubular secretion, you'll learn more about ADH. And so what is ADH? ADH is the abbreviation for anti-diuretic hormone. It actually causes an increased reabsorption of water from the collecting ducts of nephrons. Now, with ADH, it's produced by the pituitary gland, and there's a question of, how does dehydration affect the ADH levels? Well, dehydration causes an increase in ADH levels, which could result in more water being retained in the body. And so as we continue learning about the renal system and the urological system, we'll also learn about some of the conditions of the body as well. So continuing learning about the tubular secretion, we've learned about the tubular secretion and how it takes place through the nephron. Continuing, the hydrogen ions combine to form bicarbonate, and they are also released into the bloodstream to regulate overall the pH of the body, which again, when the pH is maintained in the body, that causes homeostasis. And so that's basically creating a balance inside of our bodies. Now, there is a buffer that can bind or release hydrogen to balance the blood pH. And so the question might be, how does bicarbonate molecule act as a pH regulating buffer? Well, bicarbonate molecules act as a buffer because they can either bind the hydrogen ions by creating a basic environment by decreasing the hydrogen ion concentration, or they can work by releasing the hydrogen ions, therefore creating an acidic environment by increasing the hydrogen ion concentration. So now that we've learned a little bit more about the tubular secretion, we'll next learn about the importance of electrolytes. So I mentioned before that when the body is in the system, we more than likely have water and electrolytes. And so the importance of electrolytes is for the kidneys to maintain a balance through the electrolytes in the body. And so you have specific cations and anions that are important. And so cations would include calcium, potassium, magnesium, and sodium, whereas anions would include chloride, bicarbonate, and phosphate. And so you should know that electrolytes are required for the body. And the reason why they're important is because they're important on the cardiac cycle, which anytime you hear the word cardiac, you should know that pertains to the heart. And so because the electrolytes are important, it's important for the cardiac cycle, the balance of water, the formation of teeth, and the growth of cells, for instance. So we learned a lot about the renal system and how it works as a filtration system, and learning about the nephrons and the ADH. Next, we'll learn about some of the conditions that affect the renal and the urological systems. So there are many people that can live with only one kidney or even a partial kidney function. So inside of our bodies, we have two kidneys. Now, if something goes wrong with the patient's kidney, or it gets a certain condition, or the kidneys fail, a person could be placed on dialysis or even a kidney transplant, as is sometimes necessary for the patient to continue life. There are some other conditions which include blockages, infections of the kidney, the ureter, the bladder, and the urethra. Now, there is a question of how much can the kidneys function by being reduced before health problems could arise. Well, having less than 25% of a normal kidney function can cause health problems. So a patient with less than about 15% of normal kidney function requires either dialysis or a transplant for survival. And when both kidneys are working normally, the kidneys are therefore then functioning at 100%. And so as we learn more about conditions that affect the renal and the urological system, we'll get into one of the first conditions, which is the chronic kidney disease. And so chronic kidney disease is a progressive loss of renal function. There could be certain reasons why a person might be going through chronic kidney disease. That could either be due to diabetes, or a person can have some uncontrolled hypertension. They can have glomerulonephritis, pyelonephritis, and vascular disorders. And so when it comes to the chronic kidney disease, there are 5 stages that's based on the glomerular filtration rate. Some early symptoms in detecting chronic kidney disease would include a person experiencing fatigue, headache, shortness of breath, which, remember, its abbreviation for shortness of breath is SOB. Some other early symptoms of a person experiencing chronic kidney disease would include weight changes, edema, which you should know edema means swelling. continue learning about other information about the chronic kidney disease. Dietary changes are important, as well as protein restriction. So with the kidney function in general, it decreases with age, and older individuals have chronic kidney disease, which its abbreviation is CKD. Um, so older individuals actually have chronic kidney disease more often than younger adults. Now, the progression of CKD is thought to be associated with a series of common changes in the kidneys, and this could include the glomerular hypertension, the hyperfiltration, as well as inflammation of the tubules. And for more information on this, you can also refer to table 23.1 as well as 23.2. So we talked about what CKD, basically chronic kidney disease, is. Next, we'll learn about some of the treatment for CKD. So one of the main treatments is dialysis. And so what is dialysis? Dialysis is a process of waste products that's removed from the blood. It also compensates for the lack of filtration, so the kidneys is not able to clean out itself. Therefore, dialysis would actually be doing what the body could naturally be doing. So there are two types of dialysis. You have hemodialysis and you have peritoneal dialysis. So what's the difference? Hemodialysis is where the patient must visit a clinic or a hospital. Peritoneal dialysis is an alternative to hemodialysis. And you also have another type of dialysis, which is called nocturnal dialysis, and this is where the patient would receive treatment while sleeping. Now, there are some negative aspects of dialysis, which could include additional medications that the patient would have to take to further balance their pH as well as their fluids. The inconvenience of having to be stationary for a very long length of time during a dialysis session, and the fact that even sophisticated machinery cannot perform an efficiency as the body's own kidneys. So you may have seen a dialysis clinic in the city that you live in, and to get a visual aspect of what a person would go through who goes through dialysis. They may have to go 2 or 3 times a week to get their blood filtrated. They also could be there for who knows, even 4 to 6 hours, and that could be very affecting to their livelihood and jobs if they have them. So it's definitely it can take a toll on a patient. So some drug treatment for patients who experience CKD outside of dialysis. You have to remember the nutrients are lost during hemodialysis, and they must be replaced by supplements. So some of the medicines that a person would take if they're on dialysis would include vitamin supplements. Vitamin supplements are often used because the kidneys are important in the synthesis of the active form of vitamin D, which places people with CKD at risk of having weak bones. Other drug treatment for CKD would include antihypertensives, as well as a phosphorus lowering medication. So they would definitely also be on vitamin D supplements. And so these are some of the drug treatment for patients who are going through CKD. So continuing to learn more about other conditions of the renal and urological system would include
question. I'm sorry to cut you
yes.
off.
Go ahead.
Since we're talking about like supplements and vitamins and stuff like that, iron deficiency, what is that exactly when somebody has to take vitamin, what is it? I guess like iron for their, like an iron supplement for iron deficiency? Like, why is
So
that?
that's where the person's blood doesn't have enough iron in it. And so we know that any time that our body is not producing or having any of the natural components that it's supposed to have, a lack of vitamin deficiency in our bodies could cause other issues. So a person who's anemic um, uh, they would actually be provided, or based on their physician's choice, would be possibly prescribed a iron pill, or also encouraged to eat more food that has iron in it. Um,
Mm-hmm.
so
Does
that
iron deficiency cause weight loss, or can it cause issues that lead to weight loss?
that's a great question. There could be different factors of why someone would be losing weight, especially if it's rapid or if it's a lot over a certain period of time.
Right. Okay. Thank you.
Absolutely, that's a great question. So continuing learning about other conditions of the renal and urological system, we'll learn about kidney stones. And so kidney stones are a small clump of material that form in the kidneys from substances that pass through the renal system. Um, Kidney stones would include cysteine, uric acid, struvite, calcium phosphate, and calcium oxalate. Now, kidney stones do not cause any symptoms unless they block the flow of urine. And so when blockage does occur, it usually results in extreme pain. And so the most commonly used surgical procedure for kidney stone removal is an abbreviation of ESWL. And so with that, it produces the procedure actually uses external shock waves to break the stone into particles, which can be passed into urine. And so, for examples of what that may look like, you can refer to figure 23.8 in your books. Now, for patients who are taking medications for this particular condition, some drug treatments for the kidney stones would include calcium channel blockers and alpha blockers, which would be used to help speed up the stone passing and also reduce the pain. Now, for patients who uh, are on drug treatment for prevention of stones, they may be prescribed calcium. Examples would be the thiazides and potassium citrate. They may be provided or prescribed uric acid, which an example would be allopurinol and potassium citrate. And then another drug treatment for the prevention of stones would include cysteine. For cysteine would be for them to be prescribed captopril, tiopronin, and potassium citrate. And so with the stones, they may pass on their own. And for a person who has larger stones, um, uteroscopes and or surgery might even be necessary. So for patients who are dealing with kidney stones, it's encouraged that they drink a lot of water and limit their caffeine intake. So now that we've learned about
Hey,
CKD,
Miss, another
yeah.
question. Okay, so I've been diagnosed with kidney stones like in the past year,
Mhm.
and they did give me certain medication, but I didn't really take the medication like I was supposed to because
Mhm.
the pain on its own sometimes, or do I gotta go get like another CAT scan, or how does that work?
That's a great question for your primary physician to see how they. I'm not
Okay.
trying to be funny. You know I was going to say that. That's a great question for your primary care physician to see how they would like to
But is it
further.
possible for them to go away on its own, like if you drink a lot of water and change your diet?
I cannot say if that is. It could, like they do pass on their own, based on studies
Okay.
and what has been shared, and so that's why some people might, if they have been known to have kidney stones, maybe after the detection, they start, lifestyle changes, lifestyle modifications, drink plenty of water, and may even
Okay.
limit
And
their.
I'm driving, so I'm not sure if I caught it. But what are the causes again of kidney stones?
It's a calcium. It doesn't necessarily say the causes. It just says what the kidney stones are. So
Okay.
it's basically clumps of material that form in the kidneys that pass through the renal system. So our kidneys work as a filtration system.
Mhm.
So maybe there was a buildup. over a certain period of time.
Okay. All right. Thank you.
Absolutely. So now that we learned about kidney stones and the drug treatment for that particular condition, we are next going to learn about edema. So edema, remember I mentioned edema have to do with swelling. And so edema is basically excess of watery fluid in the cavities or in the tissues of the body. So that would actually result in your body looking swollen, or a part of your body, something swelling on your body. The causes of edema could be caused by CHF, which its abbreviation means congestive heart failure, or it could be caused by hypertension, which we know is high blood pressure. With CHF, the heart muscle is weakened by the disease, therefore decreasing the efficiency, and the blood is pumped less throughout the body. So some signs and symptoms include edema, chest pain, fatigue, dyspnea, and oralgia. Now, anytime you hear the word dyspnea, it represents difficulty breathing. Ortho is difficulty breathing while lying down. So that's the differences between the two. Um, Anytime you see the word dys, I'm referring to the medical prefix DYS. Anytime you see the word dys, that represents difficulty. And anytime you see the word pnea, which is PNEA, that represents breathing. So dyspnea represents difficulty breathing. And for more information on this particular example, you can refer to uh, figure 23.1. So in continuing learning more about edema, for patients dealing with HF, which is better known as heart failure, the kidneys retain fluid, therefore it puts more work on the heart and creates a vicious cycle, excuse me. Unfortunately, there is no cure for a person who has heart failure. Now, hypertension can damage the heart muscles, the veins, and also lead to heart failure. So it's important that patients avoid salt in sitting for long periods of time, because water can be retained in the body. So this is why when people are traveling, they'll tell them, try as much as you can, to get up, or, to stretch, or to kind of circulate, your blood in the body. That requires for you to move your arms, move your legs, move your body. When you sit still, sometimes things can just sit. And so you always kind of want things to be circulating. So heart failure must be treated, and there are several other medications that's discussed if patients go through heart failure. And so they might be prescribed a angiotensin blocker, or a angiotensin receptor blocker, or angiotensin converting enzyme. They could be prescribed a beta blocker. They could be prescribed a calcium channel blocker, and they could also be prescribed diuretics. So that's better known as ABCDs. That's what it represents, as an example. So more information on the drug treatment for edema. It actually depends on the underlying cause of the edema, if it was heart failure or if it was hypertension. So the main drugs that are prescribed for the treatment of edema would include diuretic thiazides and thiazide-like agents. So thiazide, um, like thiazides, diuretic thiazides, is anything that could end in thiazide. An example would be hydrochlorothiazide, that's known as a diuretic. Other examples would be loop diuretics and potassium-sparing diuretics. An example of a loop diuretic would include Lasix. An example of a potassium-sparing diuretic would include aldactone, which its generic is spironolactone. Other medications would include carbonic anhydrase inhibitor, as well as osmotics. These are better known as the drug classes for edema. Now, there are two common beverage ingredients that are diuretics, and that would include caffeine and alcohol, which are known as diuretics. So, whenever you hear the word diuretic, you should know it's an agent that increases the urine output and excretion of water. So it's going to make you go to the bathroom. So drinking a lot of caffeine or drinking a lot of alcohol is going to make you go to the bathroom. So continuing, we learned about some of the drug treatment for edema. Let's get into what those really consist of. So the thiazides and the thiazide-like agents, how do those drugs work? They work by increasing the urinary excretion of sodium and chloride ions equally. They also work by inhibiting the normal process of reabsorption with ascending tubule following the loop of the Henle and the distal tubules. It works by increasing the loss of potassium and bicarbonate. It also has a rapid onset of action. The side effect of thiazide and thiazide-like agents is frequent urination. And it's important that you understand that if it's taken early in the day, it's to avoid nocturia, which would mean the person would be getting up, going to the bathroom constantly through the night. So it's important if a person is going to take this particular medication that they take it during the day, because if they take it at night, then they're going to be experiencing going to the bathroom a lot at night. Other examples of the diuretics would be the loop diuretics. And so the loop diuretics work by inhibiting the reabsorption of sodium and chloride in the proximal convoluted tubule and the distant convoluted tubule and the loop of the Henle. It works with a great deal of potassium. Well, when a person takes a loop diuretic, there's a great deal of potassium that's lost with urination. And so it's important that the diuretics are to be taken early to avoid nocturia. Again, nocturia means they're going to frequently be used in the bathroom during the night. So it's always important that this information, especially if it's on an auxiliary label, will be placed, to remind the person, take this during the day. Learning more about other diuretics would include the potassium-sparing agents. Now, these work primarily in the distal convoluted tubule, and they work by inhibiting sodium reabsorption and decrease the potassium loss in urine. Now, with large quantities of potassium-rich foods, those must be avoided. So what's a food that's naturally high in potassium? Bananas. Other fruits that could be naturally high in potassium would include orange juice and potatoes. Those are all high in potassium. And I love me some bananas, and I love me some orange juice, and I love me some potatoes. So that would definitely be challenging for a person who is on a potassium-sparing agent, and they like all of those foods, and they have to limit the large quantities of them. Continuing, potassium-sparing diuretics are generally weaker than the other two types, which is why they are often used in combination. And you can refer to table 23.3. Learning more about other diuretic classes, you have the osmotic diuretics. And with the osmotic diuretics, they work by inhibiting the tubular reabsorption of the water by increasing the osmolarity of the glomerular filtrate. Osmotic diuretics are also used for prophylaxis of acute renal failure when the glomerular filtration is reduced. Now, some of the agents include urea, glycerin, and isosorbide, which could also be used for glaucoma. And so I mentioned the word osmolarity. You should understand that osmolarity is the concentration of an osmotic solution, which is often measured in osmoles per liter of solution. So basically, it means it's an increasing osmolarity of the glomerular filtrate, which means that the osmotic increase, it means that the osmotics increase the concentration of particles that's found in the filtrate. And so we cannot talk about the kidneys and the renal system without talking about the urological system. And what affects the urological system, one of the conditions would be a UTI, which is the abbreviation for urinary tract infection. And so a UTI is actually a common cause of bacterial infections. Now, women are actually more susceptible because they have a shorter urethra. And so if a person also goes through multiple catheterizations, that could be another cause of a UTI. Uh, a, a person having a kidney infection, an example would be glomerulonephritis and pyelonephritis. And if a person has a bladder infection, it would be called cystitis. And so most UTIs are caused by E. coli bacteria from the digestive tract. And as far as over-the-counter items go, cranberry juice contains a compound that helps prevent bacteria from adhering to the lining of the urinary tract. So you may have seen some over-the-counter items like azo or azo cranberry that is better known to assist with UTIs. Um, it's important to understand that a UTI can actually happen to anyone. Anyone can get a UTI. Um, and again, the most common cause of it is it's the most common cause of a bacterial infection. And so some of the symptoms of a UTI would include uh, different symptoms because you have upper urinary tract infection and then you have a lower urinary tract infection. Symptoms of the upper urinary tract infection would include lower back pain, stomach pain, nausea, vomiting, and headache. Symptoms of a lower UTI would include frequent but small amounts of urine, dysuria, and sometimes incontinence. Incontinence means bedwetting. Um, and you might be thinking, what's dys dysuria? Remember, I told you anytime you see the word dys, that represents painful or difficult. So dysuria represents painful or difficult urination. So that means it hurts for someone to go to the bathroom um, and eliminate liquid waste. Now, some of the medications for urinary tract infections would include bacterial antibiotics, which could include cephalosporins and fluoroquinolones. If a person has a fungal infection, the medication of choice would be fluconazole, which its brand is diflucan. Another drug treatment of choice for UTI would be tetracycline for an infection that's caused by some STDs, and STD is the abbreviation for sexually transmitted diseases. So we learned about some various conditions of the renal system, which would include edema. We talked about CKD, which is chronic disease, chronic kidney disease. We learned about the functions of the kidneys, and as we talked about different conditions, I said we learned about edema, CKD. We learned about kidney stones. We also learned about some of the drug classes for the kidneys. And lastly, we're going to talk about urinary incontinence. And so, again, with urinary incontinence, um, that means the person goes to the bathroom a lot. So urinary incontinence is a common urinary condition. It's more seen in older adults, females, and women with multiple pregnancies. There are some things that can cause urinary incontinence, which is a such thing called stress continence, which could be through coughing, sneezing, or a force that's placed on the bladder, and then the urine is released. Um, there's an urge incontinence, which has several causes, which could be a decreased bladder capacity, a person having an infection or irritation. Uh, Other ways how urinary incontinence could cause a risk is there's a risk that's increased by alcohol and caffeine ingestion. And the common non-drug therapy treatment is actually Kegels. Those are exercises that involve the tightening of the pelvic floor muscles. And so that's something that some physicians, or should I say prescribers, actually encourage for patients to do so that they can, try to work on preventing the urinary incontinence. And so when you hear the term urinary incontinence, in today's terms, the common term is known as OAB, which is the abbreviation for overactive bladder. You may want to write that down. Overactive bladder is the common term that's used for urinary incontinence. That just means someone who keeps going to the bathroom and they can actually, and they're actually using the bathroom without, it's basically kind of like involuntary. So there's a such thing, like it's mentioned here on this slide. You have stress continence. Stress continence, that's where if someone coughs, a little bit of urine might leak, or if they sneeze, a little bit of urine might be released. Or have you ever laughed so hard, like maybe this doesn't, you don't maybe have a condition, but have you ever laughed so hard till you actually peed on yourself? Like that's kind of, but it's more frequent. So that's urinary incontinence. And so for more information on that, you can refer to table 23.5 in your book. And that's actually going to conclude chapter 23 as we learned about the therapeutic agents for the renal system.